how are GPs coping? Are they dealing with the demand in states where they are being impacted by COVID outbreaks?
It's just been a massive transfer, a lot of the burden of care to general practitioners. Certainly Delta, we were never going to see these sort of numbers. Omicron's just shifted the whole game. And certainly, particularly after the PM went and said, just call your GP if you've got a positive test, which was probably not the right message. There's been this significant shift of need to care for patients that have mild or moderate symptoms, and also be able to assess people if they need to be escalated up the chain in terms of more aggressive treatment because people are deteriorating, but also just dealing with the amount of anxiety that's out there as well with regards to Omicron and COVID, and with people not sure about whether symptoms that they may be suffering are things that they should be worried about.
We know about the Code Brown in Victorian hospitals, which kicked in at midday today. In Sydney, there are some nurses striking. What's the situation there in South Australia? How are hospitals in your state dealing with that extra pressure from the Omicron outbreak?
So certainly in South Australia, the management in terms of sort of slowing it down has been much better. Nevertheless, we're still getting enough cases, and the big issue here is the health system being somewhat smaller and therefore not having that extra reserve overall. And so it is somewhat more exposed. So the numbers are actually getting towards 300 cases, as I understand, in hospital. The numbers in ICU at about 20 or so. These are still expected to go up, even though the cases seem to be stabilising. The lagging issue is going to be the number of people in hospital. So there are still significant concerns, and the pressure is enormous at the moment. Much like in the eastern states, the number of people coming in needing treatment, but also the number of people in terms of health workers who are off work at the moment because they're furloughed, and therefore putting all the pressure back onto exhausted other staff who are having to do extra overtime, lots of extra shifts just to keep the system going.
How's the childhood vaccination program going in terms of the rollout? We're only around a week and a half in, but a GP is now saying that they do have enough supply for those vaccinations to meet demand. Have those teething problems we saw in the first few days of the program now been resolved?
Well, the reality is no, that they would like a lot more. I think it's become really obvious that general practice is the place to do the childhood vaccinations in particular, because of the assurance that kids have and the confidence they have in general practice, a more familiar environment, and also parents are more comfortable sometimes coming in as families. And so, unfortunately, general practices have been very keen to provide these vaccinations for the children that they care for, but unfortunately, they just haven't got enough vaccines. And I suspect that really when we look back at it, we could have probably shifted a few more towards general practice. Nevertheless, a lot are being done, and at the same time, there's this massive booster vaccination program that's going on at the moment, which will probably make January our biggest month ever.
National Cabinet is meeting tomorrow. What are your hopes for National Cabinet's plan for kids to return to school? Is it wise, in your view, to send kids back to school at the peak of an Omicron wave when they wouldn't have had 2 jabs?
Well, it's interesting actually, because I think it's a very, very difficult question. I do agree with, it is the last place you close and the first place you open. But there are a few issues. Certainly down with modelling, again in South Australia, they've actually worked out that sending kids back to school increases transmission in the South Australian context by about 8%. And so South Australia has made a decision to make a staggered start back at school. I think that the other issue is just allowing people enough time to get the vaccination and for that first dose to have an effect. We know that the first dose already reduces any tiny risk of severe disease by a further 80%. And the other thing is that what we don't have clarity and consistency right across the country is just the plan, the actual day-to-day planning for kids to go back to school. And there are matters such as ventilation, the rapid antigen testing program, the vaccination of kids, the wearing of masks, provision of the right PPE, strategies in terms of what happens if a child does have COVID and there's an outbreak in schools. Do you have to close down? Because, if we end up in a situation, we send them all back and they all close down again because of outbreaks, then we won't have achieved very much. So all this real pre-planning has been somewhat missing, and maybe it has been done intermittently, but we don't see it being a very, very clear thing and consistent across the country, which obviously affects people's confidence and particularly parents' confidence.
Yeah, hopefully it'll become a little clearer for parents around the country tomorrow after that National Cabinet meeting. There is a push in some quarters, I see, to reduce isolation requirements for COVID positive people from 7 days to 5 days, like we've seen in the UK. Would that be a good move here, do you think?
Well, it'd be a bit like moving the goalposts for the close contacts. It's a decision that would be made because we're forced to, not because we want to. Because what it would do is obviously increase the risk of people who remain infectious going out into the community. Now, the CDC have changed their advice. That their feeling is that most of the infections occur the 1 to 2 days before infection and 2 to 3 days after you develop symptoms. And for people who are asymptomatic after 5 days, they can go back, but they need to wear a mask after that, and ideally one of these sort of heavy duty N95 masks. But I think from the Australian context, obviously it's a balancing act, but it's something that we should be really weighing up, because every time we make a decision like this and change the goalpost because we're forced to, we end up in a situation of increasing the risk as well and accelerating this thing. And it's not just accelerating in the community, it's accelerating within, in workplaces, for example, because then you spread around and you're back in the same trouble. You've just brought everything to a head much more quickly. Now, that may not be a good thing. So, look, it's a decision which I think has to be thought out very carefully. And certainly I wouldn't be very keen unless they can show us some better science about this issue about infectivity after getting COVID.
Dr. Moy, just finally on another matter, I see the AMA today has launched this new campaign about the dangers of sugary drinks compared to the other stresses in the system at the moment. Why are you making this a priority now? Surely by now everyone's pretty aware that those sugary drinks aren't exactly good for you.
Do they? I think that's one thing. I think it gets overrun by all those great ads, those beautiful ads. So first up, we're trying to change the perception and make people understand that what they're drinking is actually rotting them on the inside, and it's sickly sweet, as we call it. But I think, what if I told you, and I told some of the listeners who are very sceptical, that we could actually do something which would barely affect the local industry, less than 0.5% of domestic production, would increase save the lives of many people, reduce the obesity level by about 2% in the next 5 years, and probably save $1 billion or somewhere between $600 to $1.5 billion, and we'd hardly have to do anything. Well, that would be a 20% increase in the price of sugary drinks caused by a 40 cents per 100 gram tax on sugar in sugary drinks, which have no nutritional value. If we did that, I know people will say, "Oh, you're the Grinch, and it's all control." But I think one day we may look back. This is something that we needed to do. Countries like Mexico and the UK have seen this. It's an epidemic, and just like the science that we look at modelling for COVID, the science is pretty damn obvious for this. Not just in terms of improving people's health, but also improving the state of the budget, which I think we probably need to be focusing on as well at the moment.
Dr. Chris Moy, always appreciate you making the time for us. Thank you.
It's a pleasure.